Hey y'all, just checking in, seeing how everyone's doing. Happy Friday. Hope that your September's off to a good start. This is my attempt, I guess my successful attempt at being consistent because this week has been a crazy week for me. I have been out of my house and at conferences and interacting with people since Monday, and it is currently Thursday, and you're going to listen to this on Friday or whenever you do listen to it. But it's been a really rewarding experience this week. I was able to be part of the Council on Black Health's conference or actioning session, which I thought was really awesome. It was around creating a collaborative roadmap and building an actionable plan for healthy Black communities, which is something I'm always about. And I think many of you listening to this are probably also very much about. But before I get into like more insights and things that I kind of learned, I wanted to share with you all in this kind of impromptu episode because I am exhausted, but I also want to be consistent. So I should have recorded a previous episode because I have topics, I just haven't recorded it. So this is my message to myself to be more consistent and pre-plan so I do not have to do this in the future. And maybe that's a lesson in itself there for you all. So be sure to subscribe so you can stay up to date with everything that's going on in these public health chats. Please use this link, well, a form below that you can sign to ask questions. I want to make this as valuable for you all as possible. I'm also thinking of using these as a way to read public health articles or I give my thoughts of public health articles and things that are going on in the field. So if that's something that interests you, just let me know. Like use the form below. Greatly appreciate that. And subscribe and share it with someone. That helps this podcast, the platform, myself really get out to more people. And as you can see, it's like 9:30 at night, and this is going out at midnight. So I'm up here doing this work even though I'm tired. And I think that just speaks to the inspiration I kind of felt in the room in the Council on Black Health room this week. It was just really awesome to be in a room with so many Black visionaries, many people who have had outstanding careers in public health and in health saving roles. And it was just really awesome to be in this room and like work together with these minds to like action and think about everything that is going on. Unfortunately, I wasn't there to the end where they were really like honing in on all the social determinants of health and creating the action plan. But I look forward to getting that action plan and thinking about it because that's one thing that I've thought about it is why don't we have a collective action plan for Black people to move things forward? But that's neither here nor there. I'm glad that this organization is doing this work. And one of the things that I appreciated was they raised up a lot of like, this is not just an independent struggle for Blacks in America, but this is a global struggle. And how do we not speak down to the other struggles, but use all of our struggles to really advocate for the change that we need? So I'm just going to go over the Black Health Bill of Rights. This was created by the Council on Black Health. The Council on Black Health proclaims this declaration of the Black Health Bill of Rights as it frames a reference for all its actions directed towards the betterment of health status of all people of African descent. The Black Health Bill of Rights advocates, educates, and promotes solidarity and respect while underscoring the dignity of every individual and every family in our communities. While this current Black Health Bill of Rights has been created with people of African descent in the US in mind, these statements can be applied to the people of the African diaspora worldwide. And that was really highlighted in the conversations today. And before I get into the 7 articles, I was very privileged and very thankful for the opportunity to be in the room and to just meet so many amazing people, really broaden my network. I'm going to have a couple people that I met on the podcast in the future. So definitely look out for that because I'm very excited to hear more about how they've gotten into their roles and the work that they've done. But let me get to this Black Health Bill of Rights. But before I get to that, I guess the one thing that I just wanted to highlight was this was a very good conference in the sense that I feel like many times you go to conferences to maybe just learn about sessions or to network with people, but the action oriented nature of this just made it so much more impactful in my opinion. And I don't know if it was just because I was starstruck by the people that were in the room and I really wasn't paying attention to who was going to be at the conference, which I should have beforehand, because then I could have maybe prepared better questions and stuff to ask people. But regardless, it was really, really awesome to just be in a room with, as I said, Black visionaries who are doing this work and who have been doing this work. And one thing that they really highlighted was like how we need to have an intergenerational approach to health and to Black health and health in general. But of course, we know we have to focus on Black health, and when we do focus on Black health, we will get all the other populations as well, because we are very, very disproportionately affected by many, many issues, as we all know on this podcast already. So, to go into the 7 articles, Article 1 is we have the right to a culture of health that values our whole well being and allows us to achieve optimal health. Article 2, we have the right to receive respectful and dignified healthcare. Article 3, we have the right to engage with the healthcare industry and receive healthcare that is culturally sensitive and that incorporates cultural humility and structural equity. Article 4, we have the right to approach solutions to Black health from a strengths based approach that incorporates a decolonized and intersectional lens to health equity. Article 5, we have the right to transform our health by reclaiming our power and autonomy. Article 6, we have the right to honor and incorporate lessons from our past, present, and future as a pathway to restoring our health. And Article 7, we have the right to have our full humanity honored and valued. And this is really awesome. If you'll follow me on Instagram at the PH Millennial, you would have seen that I got a picture with 2 former APHA presidents, 2 really big hitters in the public health, Black health, health equity space. And it was really awesome just to be in that room and to like just hear their perspectives. And many of it was different from what I feel like I've typically heard. And I feel like I'm going all over the place here, but regardless, I'm just trying to be consistent as you all heard before. And I will definitely plan out these things better and record them. But that's neither here nor there right now. But I really, really enjoyed being there, and just some of the important lessons that I think I will share today. And I'll just share maybe 3 of them and maybe 3 of the highlights that I took. And I'll only use the things that I've taken from day one. One of the points that was made was wisdom in the room has to be there. The struggle is intergenerational. We have to learn from past experiences to know how to keep working towards our future experiences. Persistence is part of the victory. Learn up and learn down. I love the persistence is part of the victory, because many times we, in public health, we see that we're doing all this work, but when we look at those population health data, it's not moving. But that's what the system wants you to think. And I think it's important that we have to understand that we really need to get to critical masses on these issues or on these opportunities to really drive forward what is happening. And I think just being in the position where you're able to take that persistence as a victory allows you to continue on in being persistent to get to bigger victories. So just take that into consideration, especially and relating that back to your public health career. You know, being here, showing up in class, doing the work is a victory. So just remember that, because you are winning when you keep going. So just keep going and you will continue to win. Another point that I wanted to highlight was when the panelists were asked, what have we gotten right? One of the things, or I'll give you the bullet points of some of the things that were said. Recognize when we have a platform and use it up. Don't make yourself small. And then don't be shy. Use every platform you have and use it up. And I think that is very important and resonated with me as I have created this platform and I continue to advocate not only for public health, but for health equity and for Black health. So I'm just glad that that was something that resonated with me, and me showing up today is what is going to move something forward. And knowing that me showing up today is also part of the victory, and just using that to continue the momentum to do this work. Reminder before I get into the 3rd point, be sure to subscribe, share it with a friend. And if you have questions or topics, or you want me to take this show, this chat in a different direction, please let me know below in the form. I would love to hear any insights or thoughts that you'll have. Greatly appreciate it. So the form is linked below. One of the questions that I believe the panelists asked rhetorically before answering it was, why are we so easily offended? Why are we competing in our oppression Olympics? Our struggles are all connected. The struggles are worldwide. This is how they stop us from believing in our struggle and taking actions to it, by creating an oppression Olympics. By defining our struggles as unique, we have kept humanity out of it and out of the solutions that we need to have. Having our own struggles doesn't diminish someone else's struggle. The last thing that I'll highlight here is someone said, I should have spoken up louder and more frequently. We need to have different voices in different places, all demanding health equity. And I think that really hit me, because while I'm here thinking, wow, this person has done so much in their public health career, in their Black health career, in their health equity career, and still they're like, I should have spoken up louder and more frequently. And I think that's a note to anyone out there that, as a health equitist, we need to do our part to really push this forward and continue. And to the first point, persistence is a victory. So I'll leave you all with that. I need to go to bed because I'm very tired, but I greatly appreciate you all for listening to these. Once again, please comment below, use the form, and let me know what you all want, whether that's questions, feedback. I greatly, greatly appreciate that. I want to make this as valuable as possible. I know I focus a lot on public health students. Don't worry, I'm going to get to the professionals soon. Just had some topics that I'm going to cover, and I'm definitely going to ensure that I'm consistent, as well as doing this in a timely manner, so that I'm not in a hotel room tired on a Thursday night before this has to go out. And has to go out as a word. But once again, persistence is the victory. And I want to be consistent to show up for you all. So here I am. Thank you all for tuning in today. Be sure to subscribe. Be sure to share it. The last message I will leave here for you all is show up for yourself. Even when it's hard, just show up, because you never know what's going to happen. You never know what that one day is going to be for you. So show up. And happy to be a part of a community that helps and supports you all showing up and making the most of your careers, because I feel like there's a lot that we don't know, and the more that we know, the less that we know. So I will leave it there. Have a good one. Have a good weekend. Peace, everyone. Make sure to subscribe.